reasons why people may choose to go into this paired exchange program. This is basically a donor swapping program. It was established in Canada in 2009. It's a national program, so it has advantage of numbers. And patients can go into this program with one or more approved but incompatible donors. And what we try and do is we identify ways in which donors can be swapped between pairs. Many of these include blood group O recipients because of that blood group disadvantage. Match runs are conducted every 4 months, and you can see the numbers over the first decade of activity. Over 1,000 people participated on the recipient and donor side. There were 146 non-directed anonymous donors. I'm going to come back to that because that's really important in the success of this program. And in the first decade, over 660 transplants were performed. 550 went to patients who brought a donor into the system. But you'll notice 113 went to waitlisted patients. Well, how did they get involved in this? And they get involved through what's called a domino chain. This is the simplest kind of paired exchange. You have two pairs, their donors are incompatible with the recipient that they want to help. And so those kidneys are simply swapped. Donor A will give to recipient B, the pair B, and that person's donor will give to the recipient of the pair A. So that's a simple two-way swap. Now it can get more complicated. This is a three-way swap, but it could be a seven-way swap, where the donor in pair A gives to the recipient in pair B, the donor in pair B gives to the recipient in pair C, the donor of pair C gives to, and on it goes. And at the very end, there's a kidney that comes out from the very last donor that goes back to the recipient in the pair that started the chain. This is a closed chain, and it can have 6, 7 pairs, potentially more. It's just the logistics get very challenging. But the really important chains are what are called the domino chains. And a domino chain involves a non-directed anonymous donor. You can think of this person like a blood donor. They show up at Canadian Blood Services, they give a unit of blood. They have no idea where that unit of blood is going to. They just know they've helped someone who needs a unit of blood. A non-directed anonymous donor is the same. They've heard about long waiting times. They have this great desire to help. And so they come forward. They don't know anyone who needs a kidney, but they would still like to be able to donate a kidney to someone in need. And we encourage these individuals to participate in the paired exchange program. And you'll notice that the other important person that participates in this is a patient on the wait list. So what happens here is that you have this non-directed donor who donates to recipient A. That person's donor donates to recipient B, and donor B donates, and on it goes. And at the very end, there's a donor kidney in the very last pair that comes out, and it actually goes to someone on the waiting list. So this anonymous donor could have donated directly to this person on the wait list, but by participating in the paired exchange program, they've actually helped to create a chain of kidney transplants, as well as getting the person on the wait list transplanted. So this is a critical piece of the success of the paired exchange program. And you can see in this solid line that the percentage of kidney transplants done through the paired exchange program in any given year, between 40, 60, 65% of them are created through those anonymous donors who participate in KPD.